When we talk about AI in medicine, it's easy to picture some kind of sci-fi robot in a hospital. But the reality right now is actually much more practical. See, AI isn't some far-off concept anymore. It's a set of really simple, powerful tools that you can use today. And they're designed to tackle the one thing that takes up so much of your time, all that administrative work. So let's dive in and see how.
This right here, this is the whole point. The big takeaway from this new wave of technology is all about this idea. It is not about you learning some complicated new skill. In fact, probably the most important thing to remember is that you don't need to learn any coding or technical jargon. This is just about working smarter, so you can get back to focusing on what you are actually trained to do, taking care of patients.
I mean, let's be real for a second. We know what the daily grind is like for so many of you. That mountain of paperwork, the endless data entry, all those administrative tasks just keep piling up. They steal precious hours away from your actual clinical work, and honestly, it can be incredibly frustrating and just exhausting.
Okay, let's start with a scenario that I'm sure is pretty familiar. A new patient comes in and they have this long, complicated medical history. You get handed years of reports, lab results, notes from different hospitals, and it's all scattered across dozens and dozens of documents. Trying to piece that puzzle together manually, that can take hours. Hours you just don't have.
Okay, now imagine this instead. With a tool like Gemini 1.5 Flash, you just upload all those files. That's it. The AI reads and understands everything in seconds, and then it hands you a perfectly structured summary highlighting the most critical information. It's literally like having a brilliant assistant who preps every single new patient file for you instantly.
And we're not talking about some tiny, minor upgrade here. This new generation of AI is a full 15% more effective at understanding and organizing complex medical data compared to the older tools. What that means for you is fewer errors, clearer summaries, and just more reliable information right at your fingertips when you need it most. So that's how AI can help organize information you already have. But now let's build on that. Let's look at something even more powerful. Creating your own custom digital assistant to handle all those repetitive tasks that slow you down every single day.
I mean, just think about these daily frustrations, right? Juggling all the different billing codes, manually processing intake forms, trying to keep all the follow-up schedules organized. These are all absolutely essential tasks, but wow, they consume an incredible amount of time and mental energy.
Well, with tools like Google's Super Gems, you can actually build your own simple systems just by describing what you need in plain English. You can literally just say, hey, I need a way to track patient follow-ups and send out reminders, and it creates it for you. You don't have to call the IT department. You just talk or type. It's kind of like hiring a personal staff member just for your admin work.
But what if you could go a step beyond just organizing information? What if you could actually have an AI complete tasks for you from start to finish? Well, that's the next level. We're talking about an AI that doesn't just assist you, it actively works for you.
This is what's called an autonomous AI agent, using tools like Manus. And the concept is really simple. You define the medical need, the what. The AI then handles all the technical execution, the how. You basically just assign it a task, and it gets it done. No more intervention needed from you.
Just imagine the kind of work you could offload. You could ask your agent to analyze billing codes and find trends in the clinic, and poof, it generates a professional report. Or maybe you need a simple app for patients to track their post-op symptoms, or a digital checklist for the residents on your ward. You just describe what you need and the agent builds it. It's pretty amazing.
All right, let's switch gears a little. We've talked about the back office stuff, but what about your professional presence? AI can be an incredibly powerful tool for patient education and communication, especially when it comes to creating high-quality images and videos without all the usual headaches.
Think about the old way of doing things, right? You try to edit a medical diagram, and it just gets distorted and looks unprofessional. Or filming a new educational video for every single topic is just completely exhausting. Well, now, with generative AI image tools, you can make these precise, surgical edits to an image without ruining the quality. And for video, well, the change there is even more dramatic.
So, using new tools from companies like Alibaba, you can record a single, short video of yourself speaking. The AI then uses that one clip to generate multiple new videos of you explaining all sorts of different topics. And let's be perfectly clear, this is not a deep fake. It is your authentic voice, your face, your mannerisms. It's just intelligently recycling your content to deliver new messages way more efficiently.
So, after seeing all these possibilities, what's the real takeaway here? What does all this actually mean for your day-to-day practice?
It really all comes back to this. The fundamental goal of all of these tools is just to give you back your time. It's about automating the repetitive, tedious work so you can dedicate your focus, your expertise, and your energy to the complex, human work of actually practicing medicine.
And let's just be crystal clear and bust a few common myths. These tools are not some far-off dream for the future. They are ready to use today. They are not prohibitively expensive. And most importantly, they do not require you to become some kind of tech expert. They are designed for you right now.
So I want to leave you with this thought. The conversation is really starting to shift. It's no longer about the cost of adopting these tools, but about the opportunity cost of getting left behind. Your patients need you focused on medicine, not drowning in paperwork. So the real question is, can you afford not to let these tools handle all that drudge work?